Let me ask you a question. What if your medical record, the boring file that sits in a hospital database, could actually predict your future? Not just your current condition. Not just what you have today. But what you might develop 5 years from now. 10 years from now, even 15 years from now. Imagine this. You go for a normal checkup. You feel fine. You're walking, working, living normally. And then the doctor says, based on your health record and your lab history, you have a high risk of developing kidney disease within the next 6 years. Or, you're on a pathway that often leads to heart failure in the next decade. Or even, you have early signals that often appear before dementia. Now listen carefully. This is not a fortune teller. This is not superstition. This is not guessing. This is an AI system that studied millions of real patient histories and learned patterns humans simply cannot detect. Because humans don't read a person's entire life record in 1 second. But AI can. And that's why this is so shocking. For the first time in history, medicine is starting to move from reacting to disease to predicting disease. And if this works safely and correctly, it could change healthcare more than antibiotics, more than MRI machines, and more than modern surgery. Because it changes the timeline of medicine. Now let's talk about a painful truth. Even with modern hospitals, modern doctors, and modern technology, most diseases are still detected too late. Why? Because the medical system is designed around symptoms. You feel pain, you go to the doctor. You notice a problem, you get tests. Something becomes serious, you get treatment. But many of the deadliest diseases don't begin with pain. They begin silently. Let's take a few examples. Diabetes can develop for years before a person realizes it. During that time, sugar is quietly damaging the nerves, eyes, kidneys, and blood vessels. Heart disease often develops slowly. Plaque builds up inside arteries for years. Then suddenly one day, the first symptom is a heart attack. Kidney disease is famous for being silent. You can lose a large percentage of kidney function without any obvious symptoms. Liver damage can grow for years due to fatty liver disease. Many people discover it only when the liver is already severely harmed. And cancer? In many cases, cancer doesn't scream. It whispers. It grows quietly until it becomes large enough to cause symptoms. This is the tragedy. The human body is strong. It adapts. It hides problems. So the medical system often arrives late. Doctors are not the problem. Hospitals are not the problem. The problem is that the warning signs are often too small, too spread out, and too complex for humans to connect early. And this is exactly where AI enters. Now here's what makes this story so powerful. This new AI tool doesn't just predict one disease. It can predict risk for over 1,000 diseases. Yes, over 1,000. That includes heart disease, stroke, diabetes, kidney failure, liver disease, many cancers, autoimmune disorders, respiratory diseases, neurological conditions, mental health disorders, and even rare diseases. And the scary part? It can predict them years before onset. Meaning, before symptoms start. So how can it do that? Because AI learns from patterns across time. Let's simplify. Imagine you have a huge book. This book contains the medical history of millions of people. Every visit. Every lab test. Every medication. Every diagnosis. Every hospitalization. Every pattern. Now imagine the AI reads this book, not like a human, but like a machine that can detect patterns across millions of timelines. It notices things like slight changes in blood pressure over 4 years, subtle patterns in cholesterol levels, repeated infections that seem minor but are actually a warning, medication changes that often happen before a disease appears, combinations of small symptoms that doctors treat separately. Humans usually see these things one by one. but AI sees them together. And that is the breakthrough. This AI is not guessing. It's learning from real outcomes. It learns what happened to people. Then it applies that knowledge to predict what might happen next. This is the same idea behind AI that predicts weather. A weather system doesn't guarantee rain, but it can say, there is a 70% chance of rain tomorrow based on patterns. Similarly, this medical AI can say, there is a high probability you are on the pathway toward a certain disease. And if you know that early, you can act early. Now let's talk about why this matters so much. Because this is not just cool technology. This could become the foundation of preventive medicine. Right now, most healthcare is like firefighting. A fire starts, then we rush in. But what if healthcare becomes like fire prevention? What if we stop fires before they begin? Here's what could happen in the real world. If AI predicts you have a high risk of heart disease, a doctor can intervene early with lifestyle coaching, better blood pressure control, cholesterol treatment, regular monitoring, personalized diet and exercise plans. If AI predicts diabetes risk, a doctor can prevent it early by improving insulin sensitivity, guiding weight management, monitoring blood sugar sooner, adjusting diet before permanent damage. If AI predicts kidney disease risk, doctors can protect kidney function early, reduce harmful medications, monitor creatinine and protein levels, control blood pressure more aggressively. If AI predicts stroke risk, doctors can track clot risk, manage blood pressure, control heart rhythm issues, detect early vascular warning signs, and even for cancers. AI prediction could push earlier screening, faster detection, targeted monitoring, prevention plans for high-risk individuals. This is why people are calling it a possible new era. Because medicine becomes proactive. Instead of waiting for the disease to attack, we identify the risk early. We reduce the risk early. We save lives before suffering begins. But here's the big question. If this technology is so powerful, why isn't it already everywhere? And more importantly, what are the dangers? Because predicting disease can also create fear, anxiety, privacy problems, and even discrimination. In part 2, I will explain exactly how this AI works, what data it uses, and why it can predict so many diseases. So now the big question is, how can an AI tool predict over 1,000 diseases? Does it scan your DNA? Does it read your thoughts? Does it use some secret machine? No. In most cases, it uses something much more simple and much more powerful. Your clinical record. That means the same information hospitals already collect every day. For example, your age and gender, blood pressure history, blood sugar readings, cholesterol reports, kidney and liver function tests, past diagnoses, even small ones, medications you've taken, emergency room visits, hospital admissions, doctor notes, past infections, weight changes over time, smoking status if recorded, family history sometimes. Now, you might look at that list and think, but doctors already see that data. Yes, doctors see it. But doctors see it in pieces. A doctor sees you for 10 minutes. They check your current problem. They may look at your latest lab report. But they do not analyze 10 years of your health history like a full timeline movie. AI can. AI doesn't get tired. AI doesn't forget. AI doesn't miss patterns. And this is why the medical record becomes a goldmine. Because hidden inside routine medical data, there are early signals of disease long before symptoms appear. Second, what changed slowly? What happened right before diagnosis? What early clues appeared years before? So the AI is not thinking like a doctor. It's thinking like a pattern scientist. For example, the AI may learn that people who later developed kidney disease often had slightly rising creatinine, small changes in blood pressure, repeated mild dehydration episodes, certain medications, frequent infections, slightly abnormal urine tests, over a long period. A doctor might not connect these small signs, because each sign alone is not dramatic. But AI connects them as a long story. And once the AI learns that story, it can recognize the early chapters in other people. That is why this is so powerful. Now let's talk about the most mind-blowing part. How does it predict over 1,000 diseases? Because the AI is not trained to predict just one disease. It is trained like this. Here is a patient's timeline. Now predict what diseases will happen next. So instead of building one AI model for diabetes, one for cancer, one for stroke, one for kidney failure, it builds one powerful system that predicts multiple outcomes. This is similar to how ChatGPT works. ChatGPT is not trained to answer only one question. It is trained to understand language and predict what comes next. In the same way, medical AI can be trained to understand clinical data and predict what comes next. And it can do it across short-term risk, 1 year, medium-term risk, 5 years, long-term risk, 10 years. So the AI can say, in the next 5 years, this person has higher risk of these 12 diseases. Or, in the next 10 years, these 30 conditions become likely. This is a completely new way of thinking about medicine. Instead of waiting for a disease, the system predicts a risk map of your future health. Now you might ask, don't doctors already have risk calculators? Yes. Doctors already use tools like cardiovascular risk scores, diabetes risk scoring, cancer screening guidelines, BMI-based predictions. But those tools have limitations, because they are usually based on a small number of variables, simple formulas, average population data, limited disease categories. AI is different. AI can use thousands of variables at once. For example, AI can analyze 10 years of blood pressure readings, how fast cholesterol is rising, how your kidney values changed over time, how often you visited hospitals, your medication patterns, subtle trends across many tests. AI can even find relationships that humans don't know yet. That's why these AI systems often outperform classic risk calculators. Because classic calculators are like a simple map. But AI is like a satellite image. Much more detail. Much more precision. Now, this sounds like a miracle. But there's a problem. A huge problem. Because predicting disease is not just a medical issue. It becomes a privacy issue, a mental health issue, and even a social issue. Because what happens if insurance companies get this prediction? What happens if employers get it? What happens if people panic and destroy their mental peace? In part 3, we will talk about the dangers, ethical issues, and what could go wrong. Before we go any further, we need to be very clear about something. This AI tool does not tell your future with certainty. It predicts probability. That means it might say, you have a 70% chance of developing heart disease in the next 10 years. But that does not mean you will definitely get heart disease. And this is where the danger begins. Because humans don't emotionally understand probability. If you tell someone, you might develop cancer in the future, many people will hear it as, you will develop cancer. And that can destroy a person's peace of mind. It can create anxiety, depression, fear of the future, obsessive testing, panic about every symptom, health paranoia. So even if the AI is accurate, the psychological effect could be dangerous. This is why these tools cannot be released casually like a normal mobile app. Because health predictions are powerful, and power must be handled carefully. Now let's talk about a serious medical issue. No prediction system is perfect. Even if an AI model is 90% accurate, that still means it will be wrong sometimes. And in medicine, being wrong can be harmful in two different ways. 1. False positives. A false positive means the AI predicts a disease, but the person never develops it. This can lead to unnecessary stress, unnecessary medical tests, unnecessary medication, unnecessary hospital visits, unnecessary expenses. It can even lead to unnecessary surgeries in extreme cases. 2. False negatives. A false negative means the AI says you are low risk, but you actually develop the disease. This is even more dangerous because it can create a false sense of safety. A person may ignore real symptoms thinking, the AI said I'm fine. So here's the truth. AI prediction must never replace medical judgment. It must support it. And doctors must be trained to interpret AI predictions correctly. Now we enter one of the most controversial issues. Bias. AI learns from data. And if the data is not diverse, the AI becomes unfair. For example, if the AI was trained mostly on patients from rich countries, it may not perform well for people in Pakistan, India, Africa, rural populations, poor communities, underdiagnosed groups. And even within one country, the AI might be biased because healthcare access differs. Some people get regular checkups and lab tests. Other people go to a doctor only when they are seriously sick. So the AI might accidentally learn. People with fewer checkups have lower risk. But that would be wrong. It's not lower risk. It's just less recorded data. This is a major issue. Because if AI becomes part of healthcare, it must work fairly for everyone. Not only for people with good hospitals and expensive insurance. Now let's talk about the part that should worry everyone. Privacy. Because this AI needs access to clinical records. And clinical records are the most sensitive data in your life. Your health history can reveal mental health conditions, addiction history, fertility issues, chronic illness risk, genetic tendencies, future disease probability. Now imagine if this prediction falls into the wrong hands. What if insurance companies get it? They might say, this person is high risk. Increase their premium. What if employers get it? They might quietly avoid hiring someone predicted to develop illness. What if banks get it? They might judge long-term risk. What if governments misuse it? This is not science fiction. This is a real ethical threat. So if this technology becomes widespread, laws must protect people. Strong rules must exist about who can access the predictions, who owns the data, how the AI is audited, how results are explained, how discrimination is prevented. Without protection, this tool could become a weapon instead of a medical breakthrough. So now we've seen both sides. The hope. AI can help prevent disease before it begins. The danger. AI can create fear, bias, and discrimination. So the final question is, how do we use this technology correctly? How can it save lives without destroying privacy and peace? In part 4, we'll talk about the future, what this tool could become, and how preventive medicine may change forever. Now let's be clear. This AI tool is not here to replace doctors. If someone tells you, AI will replace doctors soon, that's not realistic. Because medicine is not only about prediction. Medicine is also about human judgment, understanding the patient's lifestyle, asking the right questions, physical examination, emotional support, ethics and responsibility, decision-making under uncertainty. AI cannot do that like a real doctor. But what AI can do is act like a powerful early warning system. Think of it like this. A doctor is like a pilot. AI is like a radar system. The pilot still flies the plane. But the radar shows dangers that the pilot cannot see directly. So in the future, doctors may use this AI in a practical way like a patient comes for checkup. AI scans their record. AI highlights the top future risks. The doctor reviews and confirms. Then prevention starts early. This could make doctor visits more meaningful. Instead of spending time only on today's problem, doctors can also protect the patient's next 10 years. If this becomes widely adopted, healthcare could change in a very deep way. Right now, healthcare is mostly built for treatment. Hospitals, surgeries, emergency care, all of this is designed for the moment when disease becomes serious. But imagine a future where the system shifts toward prevention. That means earlier screening, personalized monitoring plans, risk-based checkups, lifestyle interventions guided by data, targeted medicine for high-risk people. Instead of giving the same advice to everyone, healthcare becomes personalized. For example, two people may look healthy today, but AI might reveal person A is at high risk of diabetes. Person B is at high risk of stroke. So their prevention plans will be different. This is the beginning of personalized preventive medicine. And it could reduce long-term suffering, disability, hospital overload, and even healthcare cost. Because prevention is always cheaper than treatment. Now you might be thinking, okay, this is big. But what does it mean for me? Here's what it means. In the future, you may not visit a doctor only when you feel sick. You may visit a doctor to know your future risks. And your health plan might become like a dashboard. Just like your phone has a battery percentage, your body might have risk percentages. Not to scare you, but to guide you. For example, your risk of heart disease is rising. Your kidney function trend is declining. Your blood sugar is moving toward prediabetes. Your future stroke risk is increasing. And if you get these warnings early, you can correct your path. This could create a world where millions of people avoid diseases they would have developed. But there is a condition. This must be used responsibly. Because if it becomes a tool for fear, or for discrimination, it will do more harm than good. So here is the biggest lesson of this entire story. AI can predict disease. But AI cannot choose what we do with that knowledge. Humans must choose. We can use this technology to white heavy checkmark prevent suffering. White heavy checkmark extend healthy life. White heavy checkmark reduce chronic illness. White heavy checkmark detect diseases earlier. White heavy checkmark save millions of lives. Or we can misuse it. Crossmark for surveillance. Crossmark for discrimination. Crossmark for profit-driven fear. Crossmark for insurance control. Crossmark for panic and overtesting. This is why the next era of medicine is not only about technology. It is about ethics. It is about privacy. It is about responsibility. And it is about making sure that AI becomes a tool of healing, not a tool of control. So the next time you hear someone say, AI is just a trend, remember this. AI is now entering the most personal part of human life. Your health. And soon, your medical record may not only tell doctors what happened to you, it may tell them what could happen next. And that could be the beginning of the biggest medical revolution ever. If you found this video interesting, like and subscribe, because the future of science and technology is changing faster than we can imagine. And comment below. Would you want an AI to predict your future diseases, or would you rather not know?
Subscribe Info Beyond Borders now for more mind-blowing knowledge.